Hello, Dr. Brandt Gibson, and today I want to talk to you about testing, another testing mechanism, testing of vitamins to determine if you have a deficiency or dependency on certain vitamins. So the question is, what are the most common vitamins that we will actually test? So the idea, when we get a neuropathy patient that comes in, we're usually going to say, okay, there are certain typical vitamin deficiencies that we see that we want to make sure those aren't the case, because we can start treating that usually pretty quickly. So number one, the most common is vitamin B12. So with a vitamin B12 deficiency, you can actually have a pernicious anemia, and so it's important that we test this because it's a very common way to have a peripheral neuropathy is vitamin B12. So we test vitamin B12, we test folic acid, we test vitamin B1. Benfotiamine is the format you will get it in, but it's thiamine actually that we're testing for. We test vitamin B6 because if vitamin B6 is too low or too high, it can cause peripheral neuropathy. We test vitamin D. Vitamin D is becoming a very, very common cause of peripheral neuropathy that we're seeing in our office on a regular basis. So basically, as you're going through, you're testing most of the vitamin Bs and the vitamin D, and in all of these cases, we're looking for not just deficiency, but even dependency. We're saying, okay, yeah, it's in normal range, but there's problems. So the other things that we will commonly do vitamin-wise is we'll test the methylmalonic acid and homocysteine, which both tell us how well the body's using vitamin B6, B12, and folic acid. So by doing these tests, we can actually say, okay, even though you are in the normal range of vitamin B12, because of your homocysteine level, we know that you need an additional vitamin B12 amount, which indicates, of course, a vitamin dependency. Vitamin D, typically when we do a vitamin D exam, for example, we're actually looking at not normal range, but we want it in high normal range because we usually get better nerve functioning if it's in the high normal range. So again, when you've got peripheral neuropathy, one of the first tests, one of the most common tests they should be doing blood test wise is vitamins. And you want them to look at vitamin B1, vitamin B6, folic acid, vitamin B12, homocysteine, methylmalonic acid, and vitamin D at the very least. Typically, we will also do an exam for inflammation, like the C-reactive protein or something similar to say, okay, do we have an inflammation problem? We may even also test, for example, thyroid disease or blood sugar problems. Basically, all of these saying, okay, we're ruling out some of the most common causes of peripheral neuropathy. But when it comes to vitamins, there are exact vitamins we should be testing, as well as ranges that we're looking for. So if you have peripheral neuropathy, vitamin test is one of the things you should definitely consider. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget Day 69.